Researchers are calling these people NOVIDs for never having COVID, and luckily for now, I'm still one of them. But it seems unreal. How can we go out to eat and travel and the virus still not catch up to us? Well, I spoke with a doctor and he said there are reasons that NOVIDs exist, but unfortunately, we may not be keeping that title for too much longer.
What I would say, Alexa, is that people like you who have not gotten COVID yet are the lucky ones.
And there are lots of us lucky ones. Nearly 60 million Americans have never been infected with COVID-19. Dr. Thomas Campbell, an internal medicine doctor at the University of Colorado Hospital, says he thinks the biggest reason for this has nothing to do with science.
I think a lot of that is due to luck.
He says only about 1 in 4 people living with someone who has COVID also got the virus. That low percentage shows him people can be exposed and just not get sick.
I think some of it is timing. We know that when a person gets infected with COVID, they are most likely to spread it to other people very early in the course of their illness. And so if you come into contact with people beyond that window, then the chances of getting infection are less.
But timing isn't everything. Genetics may play a role too. There are several studies happening now to determine if there's a protein or a gene that keeps some people from getting sick.
A very well-studied example is in the case of HIV.
Dr. Campbell says about 2% of the Caucasian population does not make a specific protein that HIV needs to replicate. They are naturally immune to HIV. He says something similar could be true for COVID-19 too.
I think that there will likely be genetic factors that would protect certain individuals against getting infected, but I think those will be fairly rare.
But he says the genetic research happening today could help explain why some people get long COVID, and it could help make better treatments for COVID in the future. The last reason you may think you haven't had COVID, you may have been asymptomatic. Researchers at the University of Bern in Switzerland studied more than 28,000 COVID cases around the world and found 42% of those infected had no symptoms. I'm Alexa Liacco reporting.